And I just want to talk you through the A section, the airway section of the trauma bag and what we have in there. Now, we have different types of airways. So we have an oropharyngeal airway in multiple different sizes, and we also have a nasopharyngeal airway in multiple different sizes. To size up the nasopharyngeal airway, just looking at the size of the nostril, look to see if there's any deviation of the septum from previous breaks that you might have had in rugby or judo, which I've had. Just go down the easier access. And if they maintain a jaw thrust and aren't responsive, then again, something like an oropharyngeal airway might keep the tongue off the back of the throat and enable them to have an airway that's there. Now, you might find that your airways have some secretions in there. There might be some saliva, some sick, some blood. And what we use is this, which is just a suctioning kit. It's got a really nice chamber to catch all the bits and pieces, and it just sucks out anything that you can see. What I'd advise is just using some of the forceps to take out any solids beforehand. There might be teeth in there, might be bits of food, carrot, etc. that have come up. Make sure you remove the solids first and then sort of get rid of all the secretions. We also have eye gels for a more sort of permanent airway that's there, and in here, because it doesn't fit anywhere else, what we have is the femoral splint that's there. The other things that you might well require are in a nice sort of sealed bag for infection purposes, are a tongue depressor. So if you are putting in an oropharyngeal airway, make sure that you come in from the side with that tongue depressor under direct vision, slide in that oropharyngeal airway. We've got some scissors and we've also got a pen torch. So very handily, just slightly wider diameter than your sort of tubes for your secretion removal. What you've got is a pen torch, and all you do is just press down on the top of there, and that turns the light on in there. So you can have a little look inside the mouth from there. Now, if we want IV access, we've also got some means of access that come through there, and also some syringes should we require. Now, that is really the A section. If we go on to the B section that stands for breathing, what we've got in here are all of the oxygen administering apparatus that we need. Obviously, the cylinder will sit separate to this. We'll normally pump that up to 10 to 15 litres through a non-rebreathe mask. We've got the bag valve mask that's in there as well. Lots and lots of different sized access routes that come with that. We've got stethoscopes as well in there. And the last thing in the C section, which stands for circulation, what we've got are all the other bits and pieces that we require to either stem the blood flow, bandages to wrap things, and dressing should we require them. That's pretty much the trauma bag, so I hope you found that useful. If there's anything else you guys have or have any questions, then please feel free to drop a comment in the question box below. Good luck with your seasons, and make sure that you guys are prepared for whatever can happen in acute trauma or high risk sports.